Welcome to our channel. Today we're talking about Atorvastatin, a medicine that millions of people in the USA, Australia, and the UK take to lower cholesterol and protect their heart health. Atorvastatin belongs to a group of medicines called statins. It works by reducing the amount of cholesterol made by your liver. Lower cholesterol levels help prevent the buildup of fatty deposits in your arteries, which can reduce the risk of heart attacks and strokes. Who can use atorvastatin? Doctors prescribe atorvastatin to people with high cholesterol, those at risk of heart disease, or those who have already had heart problems and need to prevent further complications. Benefits of atorvastatin: lowers LDL cholesterol, bad cholesterol, raises HDL cholesterol, good cholesterol, reduces the risk of heart attack and stroke, helps keep blood vessels clear and healthy. Possible side effects: like all medicines, atorvastatin can cause side effects. The most common include muscle pain or weakness, headache, stomach discomfort, nausea. Although rare, serious side effects can occur, such as severe muscle problems, rhabdomyolysis, liver problems. If you notice unusual muscle pain, weakness, or dark colored urine, contact your doctor immediately. Precautions: avoid drinking large amounts of alcohol while on atorvastatin. Tell your doctor if you have liver problems before starting this medicine. Not recommended during pregnancy or breastfeeding. Take atorvastatin at the same time every day with or without food. Lifestyle tips for better results: follow a heart healthy diet low in saturated fats and high in fruits, vegetables, and whole grains. Exercise regularly, avoid smoking, manage stress effectively. Final thoughts: atorvastatin is a trusted medication for lowering cholesterol and protecting heart health, but it works best alongside healthy lifestyle habits. Always follow your doctor's advice and get regular cholesterol checks. Thank you for watching. Don't forget to like, share, and subscribe for more health related videos.